Assalamualaikum and hello. My name is Miss Nazira Johar. This is Medical Malpractice Lecture for DJN 125 Ethics and Law in Nursing course, Part 3.
7 tips on avoiding malpractice claims. Careful practice and documentation help you out of court. In this part, we will learn on how to protect ourselves from being involved in malpractice claims. The mistake may be done by someone else, but they could include us if we don't have enough evidence to exclude ourselves from the case. So please concentrate more in this part. I will discuss the tips that has been proposed by Edith Ann Browse in her article that was published in Journal in 2004. Even though the article was published 16 years ago, but the information are very essential and could be used in our practice. She divided the 7 tips into the 2 categories. The first category is related to documentation, and the second one is related to practice. The tips for documentation are: number 1, document correctly. You see how she's stressing the word document to show that this is very important. Make a habit of document every important things and document it correctly. Number 2, specifically identify individuals. Know their names and record if you think it will be necessary one day. Number 3, date, time, and sign every entry and write legibly. Document the date, time, and sign every entry and write it clearly. These are important information that we need to write clearly in our nursing report. This information may help us to prove, for example, if we involve or not in the incident, and don't forget to sign our report. Number 4 is make sure you are aware of the facilities policies and practices. Don't forget to ask for policy and practices of your new employer if you're working in an organization or hospital later on when you grad. This is very important for us to know how they practice the nursing care and what is their policy, so that it will protect us in the future. Tip number 5 is don't let understaffing drive you to adopt careless habit. Understaffing problem is a common problem nowadays. Most of the facility or hospital will limit the number of their staff to reduce their burden on salary. Some nurses have to work more than others. So many tasks to be done, sometimes they have to work more than 7 hours in a shift. If this situation happened to all of you, just remember, be careful and stay healthy to maintain your focus on your job. Tip number 6, don't drop the advocacy ball and get too task orientated. What does it mean? It means that we have to be a critical nurse. We are not a robot who perform tasks without thinking. We have to think. We are not doing something just knowing on how to do it, but why we do it. We have to analyze rather than just following the routines. Tips number 7, develop good relation with your patient. Normally, this is our expertise. Naturally, we have a very kind attitude towards human and even animal. Our soul is very soft. That's why we become a nurse. So use this ability to be good to all patients, even their family members, without any exception. Tips number 1, document correctly. We have all heard the maxim, or in Malay, we call it pepatah. If it wasn't documented, it wasn't done. But simply documenting something isn't enough. We must document it precisely and thoroughly. Otherwise, gaps in our charting leave us vulnerable to malpractice charge. There is no term of one-size-fits-all note that suits all patients. We cannot use the same sentence to every patient, even though at the same patient for every day. For example, today we write, Encik Ahmad is generally well today. Don't simply use the same sentence to describe Encik Ahmad's condition without observing him tomorrow or for the next day. Use our experience and knowledge to write a report specifically to each individual or patient. We have to document every important information. For example, possible complication and adverse or bad outcomes. We have to write all those things. Put the patient in mind. For example, if we attend a surgical patient, include note about if you attend a surgical patient, don't forget to note about your assessment of post-operative complications. Even though the complication doesn't occur yet, but you have to write down your assessment. For example, for head injury patient, document frequently neurologic assessment and so on. You may be done a frequent neurologic assessment and just record whatever you do. In a lawsuit or in a legal action, the timing of your finding can be crucial. The lawyer may ask, when did you observe a patient first move? For example, after hand surgery. When unusual incident occur, make sure you notify the appropriate according to facility policy. For example, you should immediately inform your nurse manager about any incident that have liability potential. Don't keep it to yourself if you have done any mistake that could cause harm to the patient. Get advice from nurse manager so that other people could help the patient and it could help to protect you too. Number 2, specifically identify individuals. Nursing entries such as MD aware, nursing supervisor advice, visitor in room don't help you. Which physician was aware? What is the name of the physician? How can you prove you inform a provider when you can't identify her? Maybe you would say that she or he, but you didn't remember her name or his name. That's not good for you. What visitor was in the room? Is it her husband or her wife, her sibling? Who are they? How can a witness be called to testify on your behalf when no one knows who he was? Especially when there is an incident occur, make sure you know every single people that was there during the incident. Always include at least the person's last name so he can be identified and contacted if needed. Number 3, date, time and sign every entry and write legibly and write precisely, clearly. Many plaintiffs' claims are based on the timing of event, the finding of what happened or did not happen, when and in what order can determine the outcome of a case. When working in hospitals that have computerized charting, the technology helps confirm and preserve that information because the computer automatically stamps, dates and insert your signature into each entry. For example, if you enter patient's information inside the computer system, you have to sign in using your staff number. Then the system will identify this is you. So indirectly, your signature is inside there. But in facilities that still keep paper records, you need to time and date every entry. For example, if you are working in a remote area whereby they don't use the computer to record everything, they still use forms and writing reports on a piece of paper. Even in our hospital, HUSM, they still use paper to record the patient's progress. The nursing report. But certain places, certain facilities in Kuala Lumpur, for example, they already use the computer system. They use iPad to write nursing report. Then everything will be documented automatically. Because as charts are taken apart for copying, we remove the charts from the patient's folder, pages can get separated and mixed up. So be sure to use a complete date, including the year and record time, on a 24-hour clock or specify AM or PM. Make sure that your watch is in synchronous with the hospital clock and that you record the time accurately. Because in certain incidents, even minutes and seconds will be considered, especially for example in the case of involving maternal and fetus, because for example heart problem, seconds and minutes is considered. It's very important. Sign every entry using a complete signature, including your license. Every nurse should have their own stamping. So after we write report, we record any documentation, then we have to sign and stamp using our stamping. Number 4 is make sure you are aware of the facility's policies and practices. As a travel nurse, you may be in a different location as often as every few weeks. So you will be very dependent on a thorough orientation to each facility. In this case, we may be working in a different facilities or hospital during our career as a nurse, or we may be sent to any facilities or other hospital for an attachment for maybe a few weeks. Review the policies and procedures manual on day 1 or before you start working. Normally, they will give you the orientation about the facilities or the hospital. Ask for their policies and procedure manuals so that you can review and identify how they practice the nursing care in the facility. So you have a solid understanding of the facility's practices. Look to your nurse manager and other staff nurses to fill you in on current practices and keep your recruiter informed if you aren't getting the direction you need. Ask for help. Asking questions if you don't understand or you have no idea on certain practices. Ask until you get clear picture of your organization, of the facilities that you have been working for. Don't let understaffing drive you to adopt careless habits. Without a doubt, understaffing can contribute to errors. You have to do everything because very limited staff. But understaffing is no excuse, legally or ethically, for substandard nursing practice. We shouldn't practice nursing at a substandard level. If you are working in an understaffed unit, be meticulous about your practice. Be careful about your practice. Don't make exception because you are busy or you are working in an unfamiliar or short-staffed unit. If a patient is injured from a medication error that you made while taking a shortcut, no one will care about a nursing shortage. All that matters is that you departed from the standard of care and that your departure caused an injury. So every time, for example, in administrating medication to patient, make sure we follow the 6 rights or the 7 rights or even 8 rights, because according to the facilities policy practice, Because if something happen, if incident happen, we, we we could say that we have followed the standard of care. We have followed the procedures manual that was according to the facility. So we are at the safe side. Number 6, don't drop the advocacy ball and get too task orientated. As I mentioned before, that we are not a robot. We have to be a criticalness. The hallmark of nursing is patient advocacy. We are the person who advocate the patient. We are the middle person who will help the patient in not even in their disease problem, also their social problem during their hospitalization. Our education encourages us to be critical thinkers who study beyond the house and understand the whys. We have to be a good nurse, not just knowing how to perform the procedure, but we have to know the why we perform the procedure, the rationale behind performing the procedure. We assess and analyze rather than just following routines. We have our own assessment. We should analyze. Don't just wait for other people to tell us that this patient is having problem. We can assess ourselves. Make a conscious effort to keep your holistic head on. Practice the perfect, the good practice every time. If a patient was on a medication at home that has not been ordered with admission orders, ask if it should be continued in the hospital. Reconfirm with the doctor that in charge of the patient. Remember to check relevant lab values before giving medications. For example, our patient is on medication for anemia problem, and we have to review the lab result for hemoglobin. Then, if the result is there are changes already in the result, then we have to reconfirm with the doctors that in charge of the patient. Push for psychiatric or social work consult if you think they are needed. Before the patient discharged from the hospital, you can give your opinion for the medical team during their visit to the patient that this patient will need social worker or someone to help her to help the patient at home. You can give your opinion on that. Don't get so lost in what has to be done that you stop being a patient advocate, and don't just be a follower. You just follow whatever instructed to you by the doctor. We as a nurse have our own judgment. We can give our opinion because we are the closest person to the patient. Rather, we are the closest patient to the patient compared to the doctor. Number 7, develop good relations with your patients. Bashing lawyers may be fashionable, but lawyers don't sue hospitals, providers, and nurses. Patients do. Long before lawyers get involved, a provider or patient relationships exist, and the quality of that relationship plays a large role in the patient's decision to seek out an attorney. You can shape your relationship with patient in a manner that protects you, or in a manner that endangers you. From your own perspective, if you are the patient. If someone causes you harm, whom are you more likely to sue? Is it someone you had a good relationship with, who made you feel she cared about you and who treated you with dignity and respect? Or someone who was dismissive, took no personal interest in you, disregarded privacy, and treated you coldly? Which one? if you are the patient. So, a good relationship will help us to protect us from being sued by a patient. If we have a good relationship, the patient will think twice, thrice before they take the legal action. But if the patient get angry with us, very unsatisfied with us, even a small mistake that we make, they will proceed to the legal action if they have the capability for.
Student, we have come to the end of our lecture. As a conclusion, I would like to show again our objective of this lecture. First one is the definition of malpractice. We have covered that. We know also the difference between negligence and malpractice. We know the 6 elements of malpractice. And these elements is very important for your future, as a guide for you to prevent yourself from involving in this malpractice. Number 4, we also have learned cases of malpractice litigation cases that we can take it as a guide for us to avoid such practice. And number 5, we know about the tips on avoiding malpractice claims. That is 7 tips, 3 tips for documentation and 4 tips for practice. I really hope that you will take these lessons as a guide for you in the future. Practice the nursing practice according to the standard of care. No shortcut, no following others. Just follow the book and just follow what you have learned during your study. With that, I would like to say thanks for your attention. These are references for this lecture. With that, thank you very much.